Welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly Webinar Series. I'm Julia Chosey, a public health epidemiologist with the Hawaii Health Data Warehouse, or HHDW. Today, we're going to be exploring the latest data released from the Behavioral Risk Factor Surveillance System, or BRFSS. BRFSS is an annual telephone survey of around 400,000 U.S. adults, about 7,800 of which come from Hawaii each year. The survey includes landlines and cell phones and is weighted to represent the adult population of the state. In Hawaii, the BRFSS is managed by the Hawaii State Department of Health, Surveillance Evaluation and Epidemiology Office, in the Chronic Disease Prevention and Health Promotion Division, in collaboration with the Centers for Disease Control. Our state BRFS coordinator, Arjuna Pant, and her team do an excellent job managing the survey and its data. And just a fun fact, BRFSS is the largest continuously conducted health study in the world. The survey collects information about health status, health-related risk behaviors, chronic condition, and use of preventive services. Here you can see many of the topics covered by the BRFSS. The survey includes a core set of questions that are asked of everyone nationally, and then optional modules that states can select, and the ability to add state-specific questions. You might want to note that not all questions are asked every year. For example, the oral health questions are only asked on even years. This allows more topics to be covered while still providing valuable data and trends. The HHDW warehouse contains BRFSS data from 2000 to 2023. However, the hhdw.org website only displays data from 2011 to 2023. This is because in 2011, the BRFSS started including cell phones in their methodology, and this actually shifted some of the results such that CDC felt that it would be best to start a new baseline. In HHDW, there are over 300 BRFSS indicators, and we'll take a look at those during the demonstration. To ensure confidentiality and reliable data, the CDC reporting standards require that all questions in which there are fewer than 50 respondents, and those estimates with a relative standard error of greater than 0.3 to be suppressed, and HHDW follows those reporting guidelines as well. On the BRFSS indicator selection page, you'll find links to some helpful resources just below the overview. In addition to our data release notes, which document any changes to the data in that year, we have some newer tools to help you search the data. These include a content map and an indicator index. If you want to learn more about these tools, there is a coffee break webinar on them on our YouTube page, or just click on them and have a look. I do want to give you a sneak of what they look like. This is the content map. So it shows all the indicators on HHDW by category and subcategory. So this gives you a single resource to explore all the BRFSS indicators available on hhdw.org. And next we have the indicator index. It's similar to the content map in that it contains all the available indicators on HHDW, but it comes as an Excel spreadsheet, so you can use the filter and sort options. It contains the same information as the content map, but also offers you a more descriptive title, the wording of the survey question, the years when the indicator is available, and the variable type. During the demonstration, we'll look at building a custom BRFSS query on hhdw.org. Here are some of the dimensions available for filtering the data. You can look at either response for yes or no questions, and for categorical indicators where there's more than one response, you can choose one. And of course, all the available years of data starting in 2011 will be available, and you can choose single years or custom years. Next are the geography options for the data. Also, if you're interested in a particular age group, HHDW offers 5 different groupings for filtering. And of course, you can also filter the data by sex, giving you the ability to see the data, just males or just females. But there's more. You can filter and display the data by a wide variety of socio-demographic characteristics of the respondent. Here's a list of those characteristics, and you can see it covers a lot of important socio-demographic options. Additionally, we've begun building health behaviors and conditions that can be used to filter or display the data. So if you were interested in looking at a particular measure among people with diabetes, you can do that. There's also obesity, ever had cancer, cigarette smoker, and meeting the guidelines for physical activity. Most of the indicators are available as both crude and age-adjusted rates, and the yes or no indicators can actually be viewed by 2 dimensions at the same time. For example, you may want to look at age and sex. The custom query allows you to do that. Switching websites to hawaiihealthmatters.org, there are almost 150 BRFSS indicators on this site. They're available at the state and county level, with some also containing data at the primary care service area. Of these, 33 have data from CDC Places, which uses a different weighting method to get estimates for small areas. Because of this, those 33 indicators are also available at the census place, zip code, and census tract level. However, CDC has not yet released the 2023 data for CDC Places, so at these smaller geographies, the data that we have the most recent is 2022. On hawaiihealthmatters.org, you'll see the trend data for these indicators, as well as estimates for a variety of sociodemographic characteristics listed here. With the release of the 2023 data, HHDW has 20 new indicators. These are chosen and created with the help and expertise of the different groups at the Department of Health, so we would like to provide a big thank you to them. Here's a breakdown of where the new indicators are located on the website. They cover a wide range of topics, and I'll actually show you quickly what the new indicators are, but I wanted to draw your attention to a new category on the website, social determinants of health. It currently only has 2 indicators, but we hope to build it out in the future. So here are the first 4 new indicators. There's one for non-melanoma skin cancer and cancer survivors with an advanced directive. The diabetes test indicator we've had on the website for a while, but we modified it to align with a change in the testing recommendations. So the new age recommendations are 35 to 70, whereas before it was 40 to 70. And then we also have a lung cancer screening question that's asked of current and former smokers between the ages of 50 and 80. Here are the new health behavior indicators, including several around unwanted sex and attempted unwanted sex. And we also added some new questions around food security and the prevalence of people who have financial stresses when buying food. Here are the new substance use indicators. We have 4 new indicators on the various ways of consuming marijuana or cannabis. And we also have a measure of the proportion of adults who use e-cigarettes that are menthol. Last, we have a new indicator about internet usage and our 2 social determinants of health indicators. These measure housing insecurity and lack of reliable transportation. There will also be 34 new BRFSS indicators added to Hawaii Health Matters as part of a new data tracker we are building, the Healthy Brain Tracker. This has been a collaboration with the Center on Aging at the University of Hawaii and will include the following topic areas: cognition, Alzheimer's disease and related dementias, ADRD risk factors, and caregiving. If this is something that interests you, be sure to register for our May coffee break when we'll be covering this new data tracker on HHM. So I'm going to continue on to the live site and start the demonstration. Here we have the Hawaii Health Matters homepage. For those of you not familiar with it, we always have a featured content. We also announce when we have new data released, and you can register for the coffee break. We're going to look at the community dashboard. So this is the place where you can start searching for specific indicators. So you can search by keyword. This searches by actual words in the indicator title. You can also filter by location. And then there's quick links to a lot of our trackers. I'm actually going to do an advanced search because I know I can filter by sources. So here, what I'm going to do is start typing behavioral risk factor surveillance system. And there's different ways that you can look at these results. I'm going to look at the indicator and location summary. This gives you a list of all of the indicators and shows you the different geographies where they're available. So you can see that the results here are also organized into categories. You can see we have a lot of indicators: diabetes, disabilities, and here you can also see those ones that are available at the census place, zip code, and census tract levels. So it's worth it to come here and explore some of these variables to see what we have. I wanted to look at adults who are sedentary to give you an example of these indicators. Okay, so the first thing you'll get is a geography selection, and you can see right away that this is one of those indicators that's available down to the census tract level. We'll look at the state though, just to keep it simple. So the first things you see are a geography filter. So if you were interested only in a particular county or census tract in this case. You could filter the data to that location, and you can also look at older data if you were interested. This is a good example of where the definition really plays a good role. So adults who are sedentary doesn't really tell us exactly what is being measured. So the definition here shows the percentage of adults who did not participate in any leisure time activities, physical activities other than their regular job during the past month. So below that, we have a little bit of information about the public health importance, and then we get into the data. So we can see that 21.7% of adults in Hawaii are considered sedentary by this definition, and the data source is the Behavioral Risk Factor Surveillance System. The nice thing we have about HHM is that each of the BRFSS indicators are actually linked to that specific indicator in HHDW. So if you wanted to do some more analysis, and I'll show you how we can modify those things, but this is a great quick way to get there. Okay, so the nice thing about HHM is it provides you with a little bit of context. So we know 21.7% of adults are sedentary. What does that really mean? Well, we can see that it's actually lower than the median value for states and territories, which is good. That's why this icon is green. It's not significantly different from the prior value. It is trending up, but not in a statistically significant way. If it were, this box would be solid, and I'll show you those windows that pop up kind of give you that additional information. We have met the Healthy People 2030 target, but we have not met the physical activity and nutrition plan target. In addition to hovering over these and getting some information, there's also a legend here. So if you ever need a little clarification, that's always available on the left-hand side. Okay, below that contextual data, we get into the trend data. So here you can see the trend over time. In HHM, we do show some of the indicators with data prior to 2011, but we also make sure that anybody knows that there was a change in methodology that year. So you can see the change over time for this indicator. And below the trend data is where you'll see the data broken out by different sociodemographic factors. So here we can see adults who are sedentary by age. And the nice thing is the system does a little statistics for you. So when you see a green bar, that means it's significantly better than the overall value. And when you see a red bar, it means it's significantly worse. So we can just quickly kind of scroll through all of these different characteristics. And this is a great way to get an idea of disparate groups that might be particularly at risk. Below those breakout data are where you can look at the data by different geographies. So since this one is available at 6 different geographies, there are 6 tabs here. I thought we might look at the primary care service area, which is a geographic approximation of markets for primary care service. So here you can see you get a nice map. You get a chart with all of the different PCSAs ranked in order from low to high. And there's also a data table. And this table can be exported to CSV. So if you want to do some data visualizations of your own, you can. So this is a great way to look at the information at a smaller geography. Below that is going to be a little information about the data source and links to more information. And then below that is, again, where Hawaii Health Matters offers you a little bit of contextual information. So this is related resources to adults who are sedentary. So this will pick out indicators, reports, data resources, fact sheets, et cetera, that are related to adults who are sedentary. So this is a great place to look, especially if you're just starting on a new topic and you want to see what's available. You can also go to our reports and publications library and do a search here. Now I'm going to go back to the homepage because I want to show you how easy it is to get to HHDW. So here's your direct link to HHDW. This is our homepage. You can get right back to Hawaii Health Matters. If you know what you're looking for, you can go ahead and build your own report. We do have some video tutorials, and again, news and announcements, and where you can register for the next coffee. But we're really interested in the BRFSS data. So let's take a look at that. This is the landing page or homepage for the Behavioral Risk Factor Surveillance System on HHDW. And what it gives you is actually quite a lot of resources. So it gives you a little information about the survey. It talks about those data release notes, which are really good to look at because they keep you aware of any changes that have happened. And then it gives you this table, which shows you each year and the number of individuals surveyed. It gives you a link to the actual survey. So if you want to see the actual questions that are being asked, you can do that. Our data release notes, and then the very detailed CDC documentation. So this page really has a lot of good resources to offer. This is also where you would find the page to do a record level data request. So if you're interested in getting record level data for your own analyses, you can click here and it will give you all the information that you need. There's also a report request. So if you're not looking for data that analyze yourself, but there's something that you are having a hard time finding, you can go ahead and put in a report request and we'll do our best. Okay, but what we're really interested in doing is looking at the data. So we're going to go here to build a custom BRFSS report. And we'll see here's a little overview. Here are those resources that I mentioned, the content map and the indicator index, the last coffee break webinar that we did on the BRFSS data release. So once this gets edited, that will be linked there. And then you can see our different categories. And within each category, there are these subcategories. So we try to keep everything organized to make it easy to explore. And let's take a look at adults with high cholesterol. As I mentioned, most of these indicators will come as crude or age-adjusted rates. You can hover over the little question mark here to give you some more information about which one is best for what you're doing. And this little question mark by each of the indicators actually gives you the question wording. So we'll go ahead and look at adults with high cholesterol. This is the default result report. And what it shows you is the 3 most recent years of data for the state. It gives you a slightly more detailed definition, and it shows you that it's showing to us by year. So we can see here for 2019, 21, and 23. So this is one of those questions that's not asked every year. It's asked on odd years. And you can hover over the bar to get the actual numbers. Or if you scroll down, there is a data table. So this gives you the estimate, the upper and lower confidence interval, the count, which would represent the number of adults who have high cholesterol, and the average annual estimated population, and a measure of statistical stability. Below this, we have some technical notes, which are really good to keep an eye on. Again, it gives you the question wording, talks about weighting. This is a suggested citation in case you wanted to use any of this data in a report. And then we have some information about statistical stability. But for those of you who are familiar with this site, you know that the power comes in the fact that we can modify this query. So let's look at this. And you might remember when I was talking about all those different ways that you can filter the data. These first 7 steps are all filters, and they have default values. So you don't have to change anything unless you want it changed. So for example, you could choose a specific year or geography. In this case, you could pick a specific age group, sex. These are those demographic characteristics. So for example, if you were only interested in a particular race ethnicity, you could choose that here and it will filter the data to show you just for that race ethnicity. And then, as I mentioned, also these health behaviors and conditions. This step 8 is where you really have all the power. So this is where you tell the system how you want to see the data. Right now, we're looking at it by year, but let's say we wanted to look at it by race ethnicity. I'll go ahead and change it to that and hit submit. And now we can see adults with high cholesterol by race or ethnicity. Keep in mind that this is all 3 years aggregated together. If you only wanted 1 year, you'd have to select that in the filter. But this is good because it gives you a little bit bigger sample size, a little more robust. So we can see that there are definitely some differences by race ethnicity. When you see these 3 little dots here, it means that you can sort the data. So here now we're looking at it from low to high, which makes it a little easier to interpret. And again, this data can be exported to Excel. But the really nice thing about this system is you can actually look at this by 2 different dimensions at the same time. So say we were also interested in sex. And you'll notice there are other options for the chart. So if you prefer a different chart to view your data, please choose it. Now what we're seeing is the data by race, ethnicity, and sex. So we can see that there aren't really any statistical differences. Well, maybe, you can tell that from whether the confidence intervals overlap. Oh, here's one. So Pacific Islander males are more likely to have high cholesterol than Pacific Islander females. And if you wanted to see just one or the other, you can click on them down here in this legend, and it will show you just in this case, female data. So that's a good way to be able to view the data. And again, we have the data table that can be exported. All of these values are stable. You may see some that are suppressed, as I mentioned, from the suppression criteria that CDC follows. Now let's give you some time for some hands-on work. Take a few minutes to explore the 2023 BRFSS data in HHDW and Hawaii Health Matters and answer these questions. So these are the answers. Let's walk through finding these. So the first one is for Hawaii Health Matters, and it asks which county had the highest rate of adults who use electronic smoking devices in 2023. So I'm going to go ahead and use the search here, and I'm going to try electronic. And here we have, there are 2 adults who ever used, but this is asking for adults who use, so current use. Again, we get our geography. This is asking for the county, so we can go straight to county. And this will show us the data for 2023 for our 4 different major counties. And we can see here that Maui actually has the highest rate of adults who use an electronic smoking device at 11%. Okay, the next question asks about how housing insecurity is defined. So this involves going to our brand new section on social determinants of health. Here's our housing insecurity question. We can hover over the question mark here and see that the question is, during the last 12 months, was there a time when you were not able to pay your mortgage, rent, or utility bills? So that's how they're defining housing insecurity. And then it asks about which age group had the highest rate of housing insecurity in 2023. So I'm going to go ahead and modify this query. It's only asking for 2023, so I'm going to go ahead and just select that year. And then it's asking about the difference in age groups. So we will see here, our data shows us that the 25 to 34-year-old adults are actually experiencing the highest rate of housing insecurity. And then the last question asks about internet usage, which is another one of our new indicators. That's in our demographics. And if you needed to find that and you weren't sure where it was, this is a great time to use the content map or the indicator index. But here we have the variable internet used in the past 30 days. We're going to modify it. And again, it's asking just for 2023. So we'll select just that year. And it wants to know the differences by race, ethnicity. So here we can see in the chart or in the table that it's our Black residents who have the highest rate of using internet in the past 30 days at 99.3%. I'd like to invite you to join us in May for our next coffee break webinar. On May 6th at 11 a.m., we'll be showcasing the Healthy Brain Tracker on Hawaii Health Matters.